Cameron here, registered physiotherapist. Today I'd like to talk to you about tightness in the traps and some misconceptions that can happen with regards to treating this tightness. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially the upper trap area, it's the muscle that runs from sort of the shoulder region to the neck and up into the base of the skull area. And it's a consistent complaint in terms of this idea of tightness. And so what I'll find a lot of patients do is they'll try to stretch this muscle a lot, right? So they'll go into these type of stretching positions throughout the day. And what will happen is, in a lot of cases, they'll get, a bit of temporary relief. Maybe it'll feel good for 5-10 minutes, and then the area will tighten up again. And what I've found and what the research has been showing is that in a lot of cases, the upper traps, although there's a sensation of tightness, in a lot of cases they're either being overused, right, as a result of perhaps weakness in a rotator cuff muscle, or they're being again overused as a result of this sort of contraction throughout the day. We tend to hold like a lot of tension in through that area in particular, and so the region becomes painful, it becomes fatigued and weak, and in a lot of cases the muscle is actually already lengthened. So by trying to stretch further, right, you're actually lengthening a muscle that's already lengthened. So it makes sense then that after a period of time, it's actually going to, in some cases, have a little bit of a fight back type sensation, right? Where the muscle will try to shorten up further. So by trying to consistently stretch it, well, you're actually going to make your symptoms worse. And so in a lot of cases, there's two strategies to help with this tightness in the upper trap area. Number one is to strengthen the rotator cuff muscles. And so in this case, you'd want to have that assessed to see if, hey, are my rotator cuff muscles or the muscles that surround the shoulder joint, are they weak, right? And then with that, you can actually build up that strength in through the rotator cuff muscles, so the upper traps, they don't have to compensate for that weakness. In a lot of cases, when there's tightness in an area, there's a reason for that, and the reason typically is that there's a weakness in a specific muscle along that joint. So that's step one. And step two is, am I overusing, right, the upper traps throughout the day? And if that's the case, again, you'll want to strengthen that muscle and not try to continue to lengthen it. And so with that, there's a few different strategies you can use. One very easy strengthening exercise is you actually bring your arms up in this position here, okay? And the reason you do this is it eliminates one of the muscles that tends to again go in conjunction with the upper trap, which is called your levator scapula. So by doing this movement here, you eliminate the levator scapula, so you can isolate the upper traps at a greater degree. And then you're simply going to do some shoulder shrugs. And then you would try and do 3 sets of 10 of those. And then the other one that I like is using, if you have an option to use a pulley or a weight of some type. And essentially what you would do is you would have your arm out at sort of a 30-degree angle like this, and then you're going to do a shrug position in this manner. So essentially thinking about bringing the shoulder up towards the ear area with your arm at this 30-degree mark. And that again will help to strengthen the upper trap muscle, which we can assume is either being overused, right, as a result of a weak rotator cuff muscle, or simply just being overused in terms of from a positional sense, right? Again, people that sit in front of the computers for long periods of time and are consistently contracting that muscle. If you have any specific questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.